Let's get started. My name's Michael Fine. As I'm sure most of you know, I'm a writer and community organizer, a family doctor, and a public health guy and president and board chair of Primary Care for All Americans. Thank you very much for joining us tonight. I know everybody's attention is on the election, which makes it somewhat hard to concentrate, but we're doing the work that the nation needs, which is working across the nation and across political divides to give this country every person in the United States needs, which is primary care in every neighborhood and every community. As we build this movement and a healthcare system that's for people, not for profit, and starts by providing primary care to everyone in every neighborhood and community. We are going to be really celebrating this thing that we've been working on together, which really has legs. Those of you who go to the local work groups will hear about local work groups really starting to do their work and pulling people together and getting those people working together to bring primary care to everybody in their own communities. I can't tell you what it's like for me to be part of these local work groups and seeing people really building something. Seeing how people across the nation are hearing this and connecting and rolling up their sleeves and getting to work. We now have something like 850 people who are involved around the country. And that means that we can taste having 1,000. And when we get to 1,000, then we'll be able to taste having 2,000. So we are making real progress, and we're making progress together. Because of what you've all done together, we've had over 100 people join us in the last month, and we've made lots of new connections to other national and community organizations that have been working on healthcare reform for years, and they are hearing our message, which is this is about bringing an essential service to everybody, and to do that, to bring people together and organize community by community. This is really a time to listen to one another and hear from people across the country how they're making this work, neighborhood by neighborhood and state by state. So, as you go into your work groups, into your breakout groups, please think out of the box. No idea is too big or too small or too outrageous. Remember, we're about building a diverse movement and a diverse movement of young people. So help us make sure everything we do is exciting and fun, so everything we do rocks. It's now my great pleasure to introduce our moderator for the evening, Patty Armstrong, and to thank the Zoom committee of PC for All Americans, which organized this Zoom, and all the workgroup facilitators, coordinators, communicators, and logistics folks, and especially to John Wright, Brian Kaiser, and Patty Armstrong, our ACE Zoom producers. Take it away, Patty.
Except that Patty may be frozen.
I just thought she was really calm.
She looks calm. So if she's calm, I will try to be Patty. And please forgive me if I'm look a little different and talk a little different from Patty. She's got such a nice smile, and I don't think I have that. Anyway, so
you have a nice smile, Michael.
I'm sorry.
You have a nice smile.
Thank you. Whatever. I was going to say maybe that might get me elected president of the United States, but never mind. So thanks to everybody for being here. Please put the name of your community and state in the chat, and the first names of 2 people you think might be interested but haven't come on a Zoom yet, so everybody understands the opportunities we have to build this together. If everybody here on this Zoom tonight brings 2 new people, we are very close to 1,000, if you bring 3, I think we get to 1,000 just from that. Remember, we're building off our new policy on culture, tolerance, and respect. So no professional titles, please. Let's focus on the work in front of us. Let's work together to find the magic words we need to open the floodgates. So first 1,000 and then 100,000 people join us from every neighborhood and community. As you may know, instead of a main speaker, we're going into breakouts to give you a chance to talk to each other and members of our steering committee and board, and to gather with others in your work groups and in your breakouts to focus on the task at hand. Is everybody ready? Groups will have 20 minutes to talk and work together. Afterwards, we'll come back together to hear from each group. You're not going to want to miss that. Groups will end about 9, so drop off if you need to, but better yet, hang around as we talk through what everybody learned. Before you make your selection about work groups, we've asked each team leader to share a quick description about what their team is working on. Let me introduce our team leads and work groups. First, state work groups, Wayne, and I don't know if Lynn got on, but certainly, Wayne, do you want to say just a word or two about what you're going to be talking about and working on?
We have so much to talk about in Massachusetts. There was kind of a cataclysmic event that occurred today where Boston Medical Center decided to divorce itself from family medicine on their OB service and just announced it abruptly today. And people are very angry about this. We're also going to be talking about, inspired by Michael Fine, who said, we want a revolution. We've got some revolutionary ideas that have been cooking that I'm looking forward to sharing with the group more specifically when we meet.
So I'm going to pick up from here and ask Pat or Pam to introduce the local work group.
We're going to have a local work group that Sarah Pastor has been creating along with Matt Libby over the last several months. Their baby is approaching gestation stage. But a couple of us are going to talk about things we've been doing to try to create local work groups on our own, what our experiences have been, pluses and minuses. So if you're interested in just finding out more about what it would be like to form a local work group to try to implement some of these ideas in your local community, please come to our session. If John can explain to us how we actually get into those sessions.
Yeah, I'll be the one that actually launches them. The leaders should automatically populate where they're supposed to be. Patty, I see that you're back, so you can jump in and do some of that discussion. But for now, let's hear from Lindsay Lopez, who's heading up our social media breakout group.
Hi, everyone. For social media, this is a great opportunity to collaborate and share creative ideas to engage people who may be interested in what Primary Care for All Americans is all about, that may not be in the healthcare industry or just anybody. We want to reach as many people as possible in a fun and engaging way. So it's a great opportunity for everyone to share what you think works on social media from your perspective as a follower, as a viewer. And yeah, it's going to be fun, creative time.
That's where I'd be. Or maybe I will be, but I also have to hold down the fort. And now the one and only Alan Roth will tell you about the newcomers/new recruits breakout group.
And so I'm Alan Roth. I'm the vice chair of the board. I've been here since the inception of this organization. So I'm happy to talk with anyone who is not quite sure why they're here and what we're doing and what we're trying to accomplish. So please join the group and I'd be happy to answer all your questions.
Okay, Patty, did we get everybody?
I think so. And I think I'm finally back. So we are super excited to be here. Some great groups that are meeting. We do encourage you to turn your cameras on, even though that will eat some of your bandwidth up. So hopefully that will cooperate with everyone. But we are trying to build community here. And it's tough to do when you're only seeing a name. So we will have each team leader record the session to collect information so we're able to discuss, and people who weren't able to join can really engage with our information. So John is going to get ready to activate our workrooms. If you do need help getting logged in, you might need to go into the More section and select your work group. If you're joining us on phone, you might need to tap your screen and see when the options show up. If you need help as we go into a breakout room, they are open now. You can click on Join a Breakout Room. Right now, some of our leaders will be popping out in just a second, but John and I will be here to support you as you make your selections. So we look forward to hearing from you guys in about 20 minutes. We'll give you a 15-minute After 15 minutes are done, we'll give you a warning that you have 5 minutes left, but go and conquer.
Talk. Can we go around and individually introduce ourselves and where we're from so I have a sense? Who wants to start?
I'll start. I'm Brian Kaiser. My day job is with the Center for American Progress I'm on the health policy team there. And I've been working with Primary Care for All Americans since the very beginning, about a year and a half. Pat, you want to go next?
Sure. Yeah, I'm Pat Tokars, and I just started tuning in a couple months ago, and we got, I don't even remember how. I think I live outside of DC, so Michael was in DC for a meeting, and hey, Gaylord,
Hey,
thanks for joining. There's my mentor, Gaylord, who created all the movements in healthcare before any of you were born. But he's here to learn and help us. Anyway, Michael gave a presentation here in front of a couple of people, and we decided to create a local work group. And so I'm happy to share kind of what we've experienced so far. It's I was waiting for the local work group the handbook to be created by Sarah and Matthew. And I said, well, where is it? And they said, well, come join the team. So I've been trying to disrupt Sarah's work ethic and get her to lighten up a little bit. But she's on a schedule to get to Australia to see her daughter. So we have to get this thing published within a few weeks. So thank you all for coming tonight, and let's get this thing done.
Good. I'll go next. I'm Margaret Grady. I have a day job as well in public health. I'm in Woodstock, Connecticut, but I have a long career and professional interest in rural health. And of course, primary care is a big problem in rural areas. And that's what drew me to Primary Care for All Americans. And I've been helping support the Central Falls local work group, and I can tell you about that.
I can go next. I'm Sarah.
Oh, I'm going to call out somebody.
I'm Sarah Pastor. I'm a family physician. I'm in San Antonio, Texas. I'm on the board of Primary Care for All Americans and am co-chair of the Playbooks work group. So we were responsible for shipping the state level playbook. And as Pat mentioned, we are trying to wrap up the final stages and launch our local playbook. And I'm hoping we can get some state level and local level work groups going here. But I'm certainly not the expert. I'm just facilitating. Oh, I should probably say my day job, right? I work part-time in private practice in a direct primary care clinic, and then also my day job, my full-time job is that I work at an electronic health records company called Elation Health that is focused on independent primary care. And my role there is head of primary care advancement. And basically, my whole job is about advancing the agenda of primary care. So it fits nicely with what we're doing here. How about
each person should call on someone, yeah.
How about Gaylord?
Well, as Pat said, I was a rabble rouser early in residency and have started some organizations interested in linking primary care with neuromedical care in a more effective, integrated way than we've accomplished in the United States over several decades. So that's a little of my background and purpose.
About Gabrielle.
I'm family medicine attending here, in Queens at Jamaica Hospital. I actually got introduced to PC4AA as a resident. And so I took some time off after graduation, and I'm excited to start again now as an attending.
Did we miss anyone? Is I'll go last.
Brendan.
Brendan.
Hey y'all, I'm Brendan Crow. I am a family physician in Asheville, North Carolina. I'm doing a fellowship in addiction medicine, and I've been able to attend a couple of these meetings, and certainly inspired by a lot of the folks who've put on such great work and just downloaded the playbook, and would love to figure out how to organize a group here at some point.
Where are you from, Brendan?
In Asheville, North Carolina.
North Carolina?
Carol.
All right. I'm Carol Levitt and I live in Rhode Island. I'm a semi-retired family doc by day. And I come from a family of what we call primary care militants. Full disclosure, one is Michael Fine. So I'm kind of feeling my way into a work group, but I'm figuring out what my role will be.
Okay, I think that's everyone.
Introduce myself, PM Kavanaugh. I 8 years as an administrator at the New Bedford Community Health Center, and I am the facilitator of the newly formed New Bedford Work Group for PC4AA, and it's been a great experience in the last several months that I've been involved with this group. Okay.
Pam is Brian. She was supposed to moderate this, but I'll just jump in. I'd like to hear from anybody who, well, I guess Pam, maybe you could tell us, start off, how did you get a local work group started, and what mistakes did you make, and what's working for you?
6 weeks ago, and when I started with a very basic contact list of people that I knew in the community, and then we had our first meeting, and basically we said, who's not at the table? Who can we invite? And from that initial group of 10, we've grown to about 22 individuals. Wow. And our work group meets every other week on Thursdays, the end of the day, and it's had great discussion. We're beginning to work on a work plan for New Bedford. We set up a meeting in early September to meet with the city mayor, and we met with him last Thursday, and we had a great meeting. Ask for anything. We're here to give you information. And he just sat back in his chair and relaxed and listened to us. And when we talked about, our long-range goal of bringing residency program into New Bedford, he stood right up and he said he would support that initiative more that the group is talking about as we begin to move forward. So we're at the very infancy stage, I would say, Pat, as far as our group.
I love that you reached out to the mayor. That idea recently floated to local playbook as well, how crucial mayors are going to be in this conversation. It sounds like you were concerned about including him in the coalition, so you were treading lightly by telling him we weren't asking you for anything.
Right.
But the truth is, I think the characteristics of the population in the city or in your community, and sort of, what they see as the major challenges in terms of like vulnerable populations and how much they're spending on EMS services and things that sort of
You're absolutely right, Sarah. And what we did, health, who the mayor wanted at the table, but we had already, taken that step before he mentioned it. So she's been a great asset because she knows the assessment of the community, the population, the needs of the community. So she's an asset to the group.
Pam, I'm curious, at the very beginning when you were 1, 2, or 3 people, what did you tell the people that you were doing? What was your 3-sentence summary that got 20 people at the table?
I developed an invitation letter, which was very simple. We knew that they had a great base of knowledge about the community. And we said, we're not asking you for money. We're not asking you for anything but a little bit of time. And from that invitation letter, we got at least 15 people to our first meeting.
How many people did you send the letter to?
18.
Wow, that's an incredible
That's a
response
really
rate.
good return rate, isn't it?
That's amazing. And so are you said you're meeting every other week? Is that a Zoom meeting or in person?
It's a Zoom meeting.
And is it in the evening or during the work hours?
It's at 3:30 in the afternoon. And from the beginning, and we've been averaging about 45 minutes
Wow.
for the meetings.
And more people keep coming each meeting, is that correct?
Each time. Yeah, every time I have a meeting, I bring up, who's still not here, and I'll get an email back from somebody that was on the Zoom, said, had you thought of this person? What about this person? So now we've got the main hospital group, the internal medicine.
He kind of runs the city at the direction of the mayor and the council. He started the presentation by saying he was hired to streamline the city government to really save money, to try to avoid raising taxes. So I said, well, we're forming a group with our local Rotary Club to try to figure out how to save the city 20 to 30% of their healthcare spend for the school system and for all the city employees. And he paid attention right away after hearing that. But Margaret, what's been your experience in Great Central Falls?
Yeah, so Central Falls, if you don't know, is the smallest city in the country. It's 1 square mile of a densely populated area, sort of tucked in Pawtucket. They are very committed to healthcare and improving the health, and implement his concept of a neighborhood health station, at least for a while. I don't think it's actually going now because of workforce issues. So Michael has done most of the work in terms of recruiting. I've mostly just been helping on the organizing side, but we have representatives from the city council, actually a representative from Mujeres Positivas, which is a group that promotes cancer screening for Hispanic women. But she's also a member of the city council, which is very handy. We have a representative from the school system who used to work in social services for the state and is very well connected on that end. A representative from the local federally qualified health center. From Progressive, there's one that I'm missing. But we've met just 3 or so times still. Oh, actually, we have a physician who is from a local family practice. Actually, he's an immigrant himself and is in the process of getting his being licensed here in the United States. We've met just a few times. It's been challenging to find a regular time that we can meet. Like I think New Bedford was able to sort of get a time, but these are meetings during the day, and so that's been one challenge. However, we are using New Bedford as a model of what works. We have been able to pretty much get an agenda of, I think primarily because we have somebody from the city council, getting the city council to pass a resolution similar to Scituate, Rhode Island, declaring that health access to primary care is a right, has become one of the sort of leading aspects of the work. But definitely the same thing as Pam said, every meeting, asking who should be there, having some, there's been discussion, should we have a community health worker represented on the group? They're, working in the community and they can bring a valuable perspective. So we haven't yet done like the invitation letter like Pam did. I think that yeah, Central Falls is a really tight knit group, a city. It's a small space. It's a population of just under 20,000 as well. So I think that getting people to ask everybody, 5 minutes, getting everybody to ask one other person to come is more the approach that we're using in Central Falls rather than like sending out an invitation letter, although that may come. So
I have a question for you, Margaret, as well as Pam. Have you tried or had success in getting non-healthcare patients, particularly patients that are frustrated about not being able to access primary care, to participate in your work groups?
that has not been a focus in Central Falls. Why do you think that would be important?
Well, I mean, these are the people that we're doing this for, and it seems like they ought to be at the table rather than us figuring out what these nameless people need and want. We ought to kind of have them at the table. That was my thought. What do you think, Pam?
We have not approached any patients. What we've done is we've reached agencies in New Bedford who deal with that, with the different patient populations. Like we have somebody who's the director of the Immigrants Assistance Program who works with those immigrant populations within the city. She's at the table, but we have not drilled down to specific patients. That could come, Pat, if we keep saying who's missing from this table.
Yeah, I think that
you
was
give me a name, I'll reach out.
Yeah, I think that was a little bit the intention behind thinking about having a community health workers join the group. They are people who know people who are without access to care.
I think,
right. And I think it is a doorway, or a link to that population. Otherwise, I think it's really hard to find someone who doesn't have primary care, has the time to participate in a group during the day.
One of the thoughts we've had in Alexandria is just that one of our meetings having a few patients that we're thinking of, particularly frequent flyers at the emergency room or people who call 911 repeatedly, come to one of our meetings and just tell their story, because nothing seems to galvanize people more than a personal story that they can identify with, one-on-one with another human being. Brendan, do you have any questions about what you'd like to see in the handbook to help you in Asheville?
No, I appreciate you inviting me. I think there's a lot of good next steps that I can do. Just a matter of make the time and have a long-term plan that's sustainable.
One thing that helped me, Brendan, was I thought I had to get this whole thing done and solved within a year, and it seemed overwhelming and impossible. So I said, okay, I'm going to think in terms of a 5-year plan, and that just took all the pressure off. So, we have time at the meetings to kind of get to know each other, to build trust, to understand why people show up or don't show up at the meetings, and sort of make sure that the meetings are structured to meet their needs, because they're the ones giving up the time, which is the most precious commodity. Sarah, any words to sort of wrap this up?
Well, I agree with what you said, that it is so inspiring to hear these stories. And it does sort of give you hope that this is possible, and that there really are people out there who want to work on this. So it just inspires me to get that local playbook out there. Because I mean, if I were Brendan, I wouldn't even know what to ask.
Right. No, exactly. Exactly.
Mhm.
Well, I think we're supposed to leave the breakout room now, but thank you all so much for
Yeah, thank
your
you. This
time.
was very informative.
Thank
Things
you.
that I can bring back to New Bedford even.
White and blue. So we are super excited to hear about what you guys did in your breakout sessions. As far as I know, we had three really robust sessions. I think we did not have a social media team end up. Is that
Yeah, I
right?
ended up joining the state work group. I got some insight from there, and maybe I'll take some of those ideas on for social media. But
All right.
good.
Well, for everyone who's on this call, let me give a plug for Lindsay as well, who has been doing an amazing job with our social media. Any support you guys can offer, either with tidbits of data or going on to sharing what's being going on out there. I mean, for those of us who are non-medical, there is so much to learn about what is available to us and how we can be a part of making this movement happen. And really, our social media platforms is a great way to access the everyday person. So connect with Lindsay if you haven't already, connect with our socials. But from there, let's hear what we're doing on the state work group level. Wayne and Lynn, how was your group tonight?
Outstanding.
Full of
Um,
information.
we um, we talked about Massachusetts, Rhode Island, and Pennsylvania, all of which are making significant progress in a variety of different ways. There was perhaps a little bit of a theme in Massachusetts and Pennsylvania exploring ways to have primary care docs come together and collaborate with communities and have their own voice and power, organize healthcare the way they want to do it and not be beholden to hospitals. And so we kind of explored that theme a little bit.
So, Lynn, what would you say is one thing that the rest of us who maybe weren't in that session could go and put into action for, the next couple of weeks or next few days?
I mean, even for me, I feel like I want to try to follow, what is happening in Massachusetts, right? To see that if, this sort of approach might be a viable option for other states. I did mention in Rhode Island, we passed some legislation that was related to primary care training opportunities and growing our access to preceptors and potentially scholarshiping, and also maybe building a new primary care medical school at our state university. So, I mean, I think, the message is there's movement, and we are gathering that information and bringing it together to share here.
I think that's amazing. Just hearing the idea of how we can come together collaboratively, and so that we can all have idea share and really push the needle forward. That's great on a state level. So now looking a little zoomed in. Yes, Wayne, before I bump out.
Before you bump out, just a quick thing. Michael Fine and I met with another person, a colleague today, about the idea of a primary care medical school in Massachusetts as well. Maybe a slightly different model, but the same concept. And the idea of potentially piloting both of those models and collaborating with each other. So there's some real energy about a community-based primary care medical school in both Massachusetts and Rhode Island that we're kind of fired up about.
Awesome. Well, let me know when that starts and I can sign up as a patient and I'll be right there.
Not a medical student, Patty?
Sure, why not? Well, with that, I know that you guys were talking about that with one of the local work groups. So Pat and Pam had a group that met, and I think you guys had the playbook team in there with you. So what did you guys end up really focusing in on tonight?
We mainly heard the story of the two local play groups. I call them play groups, but they're the work groups in Massachusetts and in Rhode Island and a little bit from Virginia, and just how eager people are once they hear just the 3-sentence summary of what it is we're trying to do, how eager people are to join, how difficult it is to find a time and a place for people to actually meet, whether it's in person or on a Zoom meeting, and just a little bit about the logistics about how do you get started. And I think what helped me was to realize, okay, let's look at a 5-year plan here. We're not going to solve this thing, in a 12-month cycle. So we can't do everything today. Let's build the foundation. Let's try to get a structure. Let's build some trust among the people. Let's build some commitment among the people, not overwhelm them, not ask them to do too much too quickly, but make it a sustainable process. So I think we're all looking forward to the birthing of the playbook that'll just sort of give more outline and specific ideas to give people the confidence to just go ahead and find one other person and then 4 people and then 6 people and just sort of build the community spirit that way. Pam, did you want to add something else?
Yeah, the emphasis is on building coalitions within the community. So we started off in a simple invite letter to like 10 people, and we got those 10 people to the meeting, and then we said, okay, for who's missing, who's not at the table, and from that we've grown to about 24 members. We meet every other week at 3:30 in the afternoon. We make it clear to them that we're not going to eat up a lot of their time. So we keep the meetings to 30 to 45 minutes, but we have had great discussion. And every week I get more people to invite to the table. So that's how you build a coalition within the community. These people know the community, and that's how we're starting.
Margaret,
That's
did you have
wonderful.
anything to add from Central Falls?
No, I think that you folks have covered it well. Thank you.
Yeah, Pat and Pam and Margaret have really been doing a ton of work with this. Sarah, if I can pop over to you from a playbook perspective, I know you guys worked on the state playbook and are working on more of a local workbook. Did you glean anything from tonight's conversation that you would like to share with the group?
Yeah, I love to hear how Pam was talking about how they approached the mayor. That recently bubbled up during our discussions in the work group about how important it would be to engage the mayor and the mayor's office because they're an essential component, an essential stakeholder, and certainly, can help move some big rocks if you're stuck. And also, you want to make sure that you're keeping them informed about what you're doing in their community. And Pam was very clear that when they approached the mayor, they said, we don't want anything from you. We just want to keep you informed, which is, a nice way to be careful about and thoughtful about how we approach someone like that and win them over. But then the other thing that she mentioned was that she went to the director of the Board of Health, which is, same thing as like the health department, and that person is a very good source of information about sort of the characteristics of your community, what the major health problems are, what your vulnerable populations are, where you have the biggest problems and the biggest needs. So I think those are, really important points that we can take back. We were thinking in that direction already, but just, sort of validates what we have been planning to include.
No, I think that's super important. Again, it's that collaborative, even within our group here, understanding each person has areas of expertise. So as Pat was saying, we are going to go far by going together, right? And it's going to be the slow and steady and not the sprint to the end. No one knows this better than Michael Fine, who has been steadily working at this for a while.
Well, I don't have anything to add about that specifically. That's really true. But I was wondering if Gabrielle had a chance to talk about the amazing outreach she's been able to do in Queens to a number of community organizations.
Oh, we would love to hear from you, Gabby.
Okay, yeah. So we're going for a grant right now through the New York Health Foundation. And so I was able to approach a local congressman as well as the senator and the borough president for Queens for letters of support. The Queens borough president actually sent in his letter of support this evening for that. Sorry, for that grant that we're going for. I didn't even give a little spiel. Excuse my voice. I'm getting over a cold. So I didn't explain what the grant was, but essentially it's to increase primary care physicians within Queens, but also get get enough community involvement to increase the healthcare pipeline as well. And then hopefully that those students or kids or whoever it is that benefits from it then wants to come back and work within this community. And so we got the backing of them. I did go to a local high school last week and spoke at their career day, their career fair. And I saw that there definitely is a need within this community here for creating more opportunity for these kids to be able to volunteer within the hospitals, et cetera. And so that way they're able to see what the opportunities are out there within the medical field and then get the hours that they need that they probably wouldn't be able to get otherwise. And so if we can help with that within that area with this grant, that would be great. At that public school, I was able to then pitch that to the principal, who's also going to give us a letter of support. And I have a meeting with a congressman's wife who's also within healthcare. I can't remember what her title is within his local office. And that's on Friday. So hopefully be able to get her support as well. So that's where we are.
Absolutely incredible. That's a lot of work happening. And I hope it gives each of you guys a little boost to say that this can be accomplished sometimes in little steps and sometimes in major leaps. It sounds like that you're making. So congratulations on a lot of that. For those of you who are joining us for the first time or might be a little newer to our call, I hope that you enjoyed your time with Alan Roth. Alan, did you have a little bit of a crew there joining you tonight?
We had a big crew. It was actually great. We had lots of different, perspectives. We from a medical student to a department chair to a direct primary care NP and an entrepreneur and a, you know, public advocate, social services person. So it was a great group. I think we had a very lively discussion about, different ways of approaching, and I hope personally I connect with every member to see how they could be more involved in the organization. There was a lot of interest in those folks that were kind of new. And hopefully that Tate, who is the student on there, still wants to go into primary care after our conversations. So if he does, this whole thing has been a win-win.
Well, Tate, you can give us a thumbs up if we haven't scared you away. Well, I do want
Actually,
to.
can I jump in with one
Please
tiny
do.
thing? And that is with support from Wayne Altman, we are about to start the first Primary Care for All Americans medical student group at Tufts. So we're hoping to see that replicated in other medical schools around the country. But thanks to the folks from Tufts who have been working on that.
Without too much difficulty, we associated with the family medicine interest group at the medical school. I'm hoping that we can generate 50 new members of PC4AA just through this.
Amazing. Amazing work, guys. Well, in terms of staying connected, couple of things. We want to know what you're learning about. We want to make sure that we connect with you guys. We want to keep you connected to this work that's going on. So a couple of things that you can do. First of all, is you could drop something in the chat right now. Let us know what you learned tonight. While you're there, in the chat is going to be a link. You can fill out our Google form so that we can continue to improve these calls. Let us know what has you staying connected so that we know how to connect to others. On November 12th, I can't believe we're saying this, but November is Friday, and just 2 weeks from tonight, we'll be hearing from Gary Noss about the Valley Health Alliance in Colorado and how they've increased the number of people in their community getting regular primary care to over 60% and climbing. So it's one that you want to be at. Make sure you register on our website, primarycareforallamericans.org. While you're there, you can click on volunteer in the contact us section of the website. Tell us how you'd like to be an active part of this movement. We desperately need skilled web designers right now. Lots of people in their own communities, the power of two, to start local work groups, and people to join our social media and development teams. So if you know someone or want to get involved in that, that's in our contact us section on our website. We also have a place to donate, support our work together with a regular sustaining contribution. This is something that is so important. And I will tell you, as someone who does fundraising, I would love to run PC4AA on words of affirmation and warm hugs, but that is not going to keep our lights on. And that's not how we run sustainable programming. We need your support financially to keep this program sustained. So whether that's $5 a month, $10 a month, $100 a month, whatever you can do, every little bit helps. And so you can do that again through your through the online portal. Once again, we need and appreciate every single one of you for helping us spread this movement across this nation. So together we can bring the change we need and you deserve. So join us again in 2 weeks. Bring another person, bring a couple of people, better yet, bring 3 or 4. This is healthcare for people, not for profit. Primary care for all Americans. Don't forget to complete our survey and the link. We want to hear from you. Thank you so much, everyone. We want to see you on November 12th. If you have any questions, feel free to drop them in the chat now. But again, we would love to hear from you and know how we can make this movement practically run with and for you.
Thanks, Patty. Good night, everybody.
Thanks, everyone.